This is KTVO's Good Morning Heartland.
And welcome back. With the days shorter and colder temperatures, many of you might be feeling a little blue, but it might be more than just the winter blues. Dr. Puckett from Complete Family Medicine in Kirksville is here this morning to talk more about seasonal affective disorder. So how are you doing?
Doing well. Good morning.
Good morning. So exactly what is seasonal affective disorder?
Well, seasonal affective disorder is even more than just those winter blues. It's a true mental health condition that's a seasonal form of depression, essentially.
Okay, and why would somebody get this form of depression? What causes it?
Well, we think, as best science can guess, we think that it's a problem relative to sunlight. So as winter comes and the sunlight seasons start to change and we start to have shorter times, we're getting up in the morning, it's dark outside, and all those changes, less sunlight's hitting the back of our eye, and for some reason it affects the way that our brain makes one of our neurotransmitters that affects mood, serotonin. And so down that cascade of events, about 5% of us every season will get this what we call seasonal affective disorder, which is a real severe mental health condition. And you say 20%,
which is 1 in 5, correct?
Right, 1 in 5.
Which you say is surprisingly really high.
Right. Yeah, I think that we often just brush it under the it's the fall, you'll get over it. But whenever it starts to affect the things that you're really enjoying, your normal activities, your job performance, that you're not being socially engaged, that you're all those things that make up normal major depression, whenever they happen year after year, trying to recognize that and seeking medical treatment for that. So that you can get rid of that winter blue.
So you just touched a little bit on it. Go more into detail of what types of symptoms people might have that do have this disorder.
Well, the symptoms can vary from just lack of interest in activities that you normally enjoy, feelings of guilt and sadness. Interestingly, one of the most common effects that occurs, especially in women, is a carb craving. And so with this that we see in the fall and winter, especially weight gain is a huge problem. And then just general apathy about life in general.
Okay, and so when you go to the doctor, is there some sort of test that they take? How are they diagnosed?
Well, it's diagnosed just based upon an interview, and so asking questions, we do use some screening forms that kind of help validate what we're finding. More importantly, to rule out some of the other mental health conditions like bipolar disorder or just simple major depression. But it's essentially a clinical diagnosis that's made by asking questions, and then treatment can begin.
And is there more cases in women than there is men, or is it?
Especially in what we call the fall or the winter, which is the much more common of the two forms of seasonal affective disorder. It's more common in women. The one that occurs not nearly as often, more rare whenever summer comes, whenever we have longer daylight, actually happens more in men, and that's usually more associated with anxiety versus the depression.
Wow. And any sort of treatments? What kind of treatments?
Yeah, well, daylight is the treatment, and there's not much you can do to turn the sun on in the morning, especially with our daylight savings time.
Exactly.
So the way that we do that is it doesn't require a prescription. You can just order one off the internet, get a 10,000 lux light box, set it about 12 to 18 inches from you, and work. You don't want to look directly into the box, so you want to be reading or knitting or doing some activity that puts you in front of that box for about 30 minutes. And that in and of itself, within 5 or 6 days, actually can start to reverse and have full remission within a couple weeks. And then there are medicines that we use as well as just therapy. Talking about some of the issues has been shown to be beneficial.
Okay. Well, thank you so much for your time.
Yeah, thank you.
We will post everything on our website at heartlandconnection.com, as well as Dr. Puckett's information if you have any other questions for him. And we'll be right back.